Hello, this morning we're going to look at providing some taping using some Hapla wave elastic muscle tape to provide an acute treatment for osteoarthritic changes that occur in the midfoot. What can happen is primarily around the intermediate cuneiform and the base of the second metatarsal, osteoarthritis can easily occur, probably from around about the age of 50 plus, but certainly also at the base of the lateral cuneiform and the third metatarsal, and certainly at the medial cuneiform here in the base of the first metatarsal. So let's look at a technique then that we can apply to the dorsal of the foot to give some immediate relief from that, obviously given how far it's gone on its pathological journey, but also that the patient can walk out and feel comfortable before we consider orthoses and lifestyle changes. So using the tape then, this is the tape. This is a very, very stretchy tape. It stretches up to about 80% of its original resting length. And what we do is just measure out some tape on the dorsum of the foot first. Remember, when you're measuring out this tape, the tape is going to stretch a lot further than you think it will. So whilst I've measured this much first, I will be removing some. Okay, what we do is round the corners as we would normally with any tape, just to make sure that no hose you can catch on it. Obviously 2 pieces here. Let's just cut those corners off right now. Okay. And then we want a third piece that will stretch across the dorsum of the foot slightly onto the anterior aspect of the leg. So let's just cut ourselves out some tape here. Now, right, put that there. What we're going to do now then is we're going to break the tape in the centre to establish some anchor points. There's a golden rule with this type of tape, and that is no stretch on the anchor points. The anchor points are the ends of the tape, where the stretch portion will be in the centre of the tape, but at the ends we don't want them pulling on the skin. So to do this, we break the tape in the centre and roll back the paper backing to roughly about 1 centimetre away from the end of the tape, like so. Then take away the paper on the other side of the tape, just roll that back. Okay, just peel that back gently. Okay. So I'll just point the tape towards me as I peel that back. There we go. So those are our 2 anchor points. And note, I'm holding the tape with my thumbs right along the edges so I can get a full stretch without curling the tape in the centre. Okay. Now, that's 100% stretch, right to the end of its stretch. Back by half is 50%, and it's 50% that we're going to use on the dorsum of the foot. We're going to apply it over this dorsum tarsal area, roughly where the osteoarthritic changes are taking place in those metatarso-cuneiform joints. Okay, so with 50% stretch, we lay it on the dorsum of the foot, full contact, and then notice, those are the anchor points, all right, where there's no stretch. So we peel away the paper and just establish the stretch, and on the other side as well. And then rubbing the tape with the waxy part of the paper, we establish some heat to activate the adhesive. Okay, this is our first piece. We're going to apply a second piece now at a 50% stretch again, moving slightly posterior to the first piece again. So we break the tape in the centre, we pull back the paper as before to establish our anchor points. There we have our second piece ready, 100%, back by half, 50%. Laying that with a 50% overlap with the foot slightly in plantar flexion, establish that over the surface and roll down the anchor points. That's part of the first half of our technique. Now, the second half is we're going to establish a longitudinal piece which crosses over the original pieces at a 90-degree angle. And where it crosses the original pieces, this is where we get the most of that skin lift to establish that greater area underneath, or deep to the deep fascia, so that inflammatory edema can rest over a wider surface area, so the hydrostatic pressure it develops under the deep fascia is lessened, allowing those other vessels, the venules, the lymph vessels, to reabsorb the edema. So with this one, we're going to tear an anchor point in a slightly different way than the first two pieces. We're going to break off one end first, okay, like so. Here's our anchor point, and we're going to apply that anchor point to the dorsal of the foot, just proximal to the base of the digits. So let's just establish that anchor point on here first. Okay. There's our first anchor point. Now we're going to peel back the paper to establish our second anchor point. And as we lay this, let's just establish that first anchor point, under 50% stretch, note we hold here, there's 100%, there's 50, we lay this down, and as we lay this down over the tape and over the anterior aspect of the leg, we keep it in close contact with the skin, smoothing it onto the leg and the skin until then we have our anchor point here, which we lay down, like so. And again, to activate that adhesive, we just rub the tape to increase the heat underneath the tape. Now ideally, this tape will stay on for about 4, maybe 5 days through baths and showers, whereupon it will probably just peel off or should be removed. It can be patted down with dry with a towel as well. And this can be in place whilst you establish your other therapeutic goals to help relieve the symptoms from that mid-tarsal osteoarthritic changes.